Today we're going to be doing an application of the Ortho-Innovations knee orthosis. This application is going to be whether the brace is a prefab brace or a custom brace. Today's application will be for a patient that has a flexion contracture and we want to gain extension. So the first thing that we're going to do is just remove our strap, our proximal strap from the D-ring. Also the same on distally. Next, we want to mimic the contracture of the patient into the brace. And we want to turn our knobs simultaneously. If you don't turn them simultaneously, the brace will have a tendency to bind. And if it does do that, you just need to readjust your knobs to where the tension is equal and the brace will bend. So you keep adding in. So we've got the proper flexion. On a flexion contracture where we want to gain extension, the brace is going to go anteriorly on the patient. When the brace is on, I want to make sure my hinges of my brace are lined up with the patient's knee joint. I want to then make sure that we're going to reapply the proximal and distal straps. Just put in enough tension on there to hold the brace in place. We'll be readjusting them again shortly. Next, we need to adjust the tension of our middle straps. First, we'll just do our proximal strap. We want to undo the Velcro from the strap. There's Velcro on the outside and the inside of the brace. Pull down on the strap to get the strap snug on the patient's leg. Keeping the tension on the strap, wrap the strap back around the brace. Again, we'll do it for our proximal tibial strap. Remove the strap, the Velcro from the strap. Remove the strap from the Velcro on the brace. Pull down so we have nice tension on the patient's leg. Keeping the tension on the strap, wrap the strap back around the brace. Next, we're going to want to readjust our distal and proximal straps. So now we can get the brace snug on the patient's leg. You will notice that there will be a small gap, about a finger's breadth, between the hinge and the patient's knee. Next, for the protocol, of course, is depending on what the physician prescribes. A typical protocol is 3 to 5 treatments a day, 25 to 30 minutes per treatment. The patient may also wear the brace at night if they prefer to do a little longer treatment. Now what we want to do is to gain our extension. We're going to turn the brace so that we start getting a nice stretch in the patient's leg. I don't want the patient to go to a painful stretch, more like a comfortable nuisance. When they get to that point, back off a quarter turn on the dials and let it sit there for 5 minutes to get their first stretch. At the end of that 5 minutes, give the brace 1 to 2 more turns on the dial, and then the patient can be there for the next 25 minutes. While the patient is in the brace, they cannot weight bear in the brace. These knobs are able to be removed from the brace. And when the knobs are removed and there's tension on the brace, there's no way that you can adjust the tension of the brace. The brace is locked in place. And the patient will be that way now for the next 25 minutes. At the end of the treatment, the patient can either reapply the knobs and take the stress off the brace, or just simply loosen up the straps. And again, this is for a prefab or custom knee orthosis.